Hello. I'll speak briefly about the way the conflict in the Middle East is represented in the process in the group, and in what way is it tackled with in the group. And I'll try to give a couple of examples that you get a flavor of how this is done. And I would say, to understand the context, the participation of the people who are not from the Middle East, as it was pointed out, the two people from Italy, Professor Caffo and Barbara Ferresi, and Phyllis Cohen and Jim Leckman, they serve in, if I would say in psychoanalytic term, as somehow of like a background of safety, to use the term of Sandler, a background of safety in his idea, and it's represented in all sorts of other ways, the same idea, is a condition that is necessary for the formation of the basic steps in development. And it can be translated in all sorts of ways. And in the group way, it's the question, how does the group develop a context of safety that it can tackle difficult issues as they arouse? This is on one side. And the other side, maybe it's important to say, that maybe the obvious, that the group of psychologists, psychiatrists, and social workers who participate in the group are old people who work a lot with children who underwent traumas of various sorts, whether it has to do with physical injury to their own people, whether it has to do with death of close people to themselves, whether it has to do with living in an environment that is bombarded, or an environment that suffers from sonic booms by airplanes. Multiple assaults on the sense of safety that has a very deep consequences, and maybe you'll see it later. We're not dealing only with the concept of PTSD. We deal with all sorts of an array of post-traumatic reactions that don't fall into this into the diagnostic category, but really affect the whole population. So this is the entry point. And maybe another thing, that all of us that are in the group are involved not only in treating people and children, families that went through traumatic situations, we also are involved in training other people. And I think one thing that we see, that we're not only people who try to help others exercise psychological techniques or psychiatric techniques. There's a great deal of difficulty in becoming close to the inner experiences of people who are suffering in a very deep way. And I think we are in a very especially tough situation, that all of us ourselves are in some way or another people who carry their own wounds, carry their own memories, carry their own deep feelings, and all these things are mixed up in our work. And in that way, even when we come and create a joint partnership of getting together to evaluate the needs of children in our area, and to work together towards cooperating in some other ways. There's in one side the task that we're dealing with, evaluation, research, application of case presentation, application of techniques. And on the other side, there's a wave of emotions that are stirred up and block the interaction, create situations of impasse. And when we set up this group, the group was set up to have a part that deals with task, deals with joint cooperative work of various kinds in research and treatment, whatever. And at the same time, there's set aside hours to deal with process issues as they evolve. So this is the framework that it's done, and Shafiq Masaho presented before, and myself, we had the responsibility on that area, even though I think the group members and the facilitators from the outside also participated in that. I want briefly to give you an example, and I'm not going to do justice to how emotionally loaded what I'm presenting now is. So I apologize to the group members and even members in the audience who may not be able to understand how charged every little thing is in our area. I want to talk about two words that are very emotionally evocative. I'll start in discussing for 3.5 minutes the word terrorism. The word terrorism from the Israeli side, the Jewish Israeli side, is a word that is unavoidable. When we presented cases in our group, we describe, like for example, in one case we described a girl who had multiple injuries after a suicide bomber exploded in the shopping area. There were over 100 people who suicided while killing other people, many times civilians, or usually civilians. And she presented the clinical issues, the difficult clinical issues in dealing with this particular girl. And it was very clear that the discussion cannot go on, because the word terrorist, that in which the suicide bomber was labeled by the Israeli Jews, including I'm one of them, the word terrorist seems to be unacceptable in a very profound way, and in a way that many of the Israelis could not imagine. Why wouldn't a person who comes and explodes himself on a civilian population in a mall, in a bus, wouldn't be a terrorist? What's more than that? And there was an impasse, and it wasn't clear whether we can tackle this, and whether this is bridgeable. In that situation, specifically, I think Shafiq Masalha presented before, maybe is in that position of being an Israeli and a Palestinian, of understanding the pain that the Palestinians feel about the term, and maybe the lack of full appreciation of why the pain is there. As there's an advantage on him being a facilitator in this situation. And we came to the group and decided to open up what is so evocative about the word terrorism. For the Palestinians, for us, it seemed evocative enough where we feel victimized, by these people, where we cannot explain, for example, this phenomena, some of it at least. And what became clear, and I'm not sure that I'm doing full justice to this, what became clear that the word terrorist is felt that it's only applied when murderous attacks on civilians, when scare tactics occur on the Arab-Muslim side. When they are the perpetrators, it's only then that it's applied. If the Israeli army is doing things against the civilian population or is using scare tactics, somehow it's not recognized as terrorism. There was an attempt to deal with it on a rational level, but then there was a sense that it goes deeper, that the word terrorism is connoted, at least by the Palestinian members of the group, the way I understood it, is connoted that the terrorist is an evil person, someone with negative motivation, who has a murderous aim, and the term itself, terrorism, somehow skips the recognition that there are political aims here, that there is a suffering, there's a plight of people, these are means that are used by a group, etc., etc. And then just to bring this particular, I hope that it transmitted how difficult it was to discuss this, and how much pain there is on the Palestinian side when the word terrorism is used again and again, and they at the moment feel there's a negligence to see that the person who's labeled this way has other motivation. And then I would add that some members said that they would feel a bit differently if the Israelis would take authorship over when their army is involved in such actions. So this is the beginning. I'm moving to my next term that seemed to be extremely difficult. I would say the first term, it goes back, the terrorism goes back to what Shafiq is saying. But he described that the way he conceives it, and I agree, that the Palestinians need a recognition of their plight. And the word terrorism somehow echoes the lack of recognition of their plight. I want to move to the next word that seems to be very loaded in our group. It has to do with the term shaheed in Arabic. In English would be martyr. In Israel, in Hebrew, it's used in the Arab word, shaheed. It's adopted. The word martyr, if I represent it correctly, it's used in our area about any Palestinian who's killed by the Israelis, in this context of the armed conflict. I think the Israelis, if I would speak from my side for a moment, the Israelis had very strong reactions, mostly to the idea of suicide bombers being called martyrs. There was the sense, kind of questions that were difficult for an Israeli Jew to understand. How can someone who kills himself while killing other people, how can he be valued and valorized and idealized and be celebrated? And his death is not even mourned in a particular way, but there's an attempt to celebrate it And somehow in the heart of Israelis, but even the Israelis in the group, and I'm including myself, there was kind of feeling perplexed or feeling bothered, and in a way threatened by what's behind this. What's behind this act of self-sacrifice that in a way is so murderous? Yeah, how to explain this? Is there an aspect of mentality that we don't understand exactly? Is this a weapon that is used by the weak? How to understand this? And it seemed that this is leading to another very, very difficult area. In our particular group, it took us, I would say, 3 years to get into this topic. This year, there was an attempt in a more ordered way to discuss this in an intellectual way, in a scientific way. But at the same time, even this intellectual presentation, immediately there is the sense that the cognitive side is accompanied by an emotional side, and the need to digest this before we can move on. In our particular group, and it's the first group I participated in many groups, it's the first time that there's the ability to talk about it professionally, and even to bring up research questions that have to do with what are the processes of mourning that occur in the Palestinian society about people who sacrifice their own lives in their national struggle. In what way is it different when someone, in what are the mourning processes and the difficulties, the familial difficulties post the death of a family member in one situation versus another situation? What is the relationship between suicidal bombing to suicide with the idea of what takes people to take their own lives? So there's all sorts of questions, and if I take this particular example, to take this extreme behavior of suicide bombing and translate it to research questions that deal with very basic reactions that we have. So in sum, to say that the process group that we have that accompanies the task group, its own attempt is really to hone on and describe, to verbalize, explore, and hopefully to translate into research, intervention, or widening of our empathic ability to bring this back into our professional realm. And I think that this particular group, with its context, with its supportive context, and with the individuals who were never blaming, there was the discussion of trauma, but without a competition on trauma. You see, this kind of dialogue appeared to be very fruitful. Thank you.